Thank you. So a man walks into a doctor's office and asks the secretary, "Do you take Medicare insurance?" "Sure we do." "Well, what's the copay?" $400 billion. You're right, it's not that funny because it's true. Well, I'm proud of all of you for being here. You are the future leaders in the fight of freedom for healthcare. Today, I'm here not just as a doctor, but as an expert witness against socialized medicine. I left Italy 30 years ago, mainly to escape from socialized medicine. And that fact, together with everything I had to witness that happened to my family, unfortunately makes me an expert. The people accuse me of conspiracy theory when I say that Obamacare is a home run towards socialized medicine. Should have been here to listen to Sally Pipes. Believe it or not, the term socialized medicine was first used in 1947 by the American Medical Association to warn doctors against President Harry Truman's healthcare initiative. At that time, the AMA was still on our side. If you Google socialized medicine, you get a term used to describe a system for providing medical care and hospital care for all at a nominal cost by means of government regulation of health services and subsidies derived from taxation. If you do not think that this just about nails Obamacare right now, you won't have to wait for very long. Even if there is no mention of socialized medicine in the I thought it was 2,600 pages, this is the last attempt to shove it down the Americans' throat. Americans have rejected all-encompassing socialistic plans in the past, like the Truman's Healthcare Initiative and later on the Clinton plans. However, we had no problem accepting more modest plans like Medicare and Medicaid, which are based on exactly the same principles. In 1973, Richard Nixon smuggled a new form of socialized medicine through the back door under the veneer of private enterprise while he signed the HMO Act, which gave $375 million in government grants and loans to the health maintenance organizations so that they could be greatly expanded and they could impose massive rationing as agents of fascist medicine. I say, Republicans like that, who needs Democrats? If we institute what Obama proposes, it will be impossible for private enterprise to function. And this will be the excuse for the government to step in completely. To prepare for that, they're already rounding us up in ACOs, accountable care organizations. I think they're upgrading the old Roman Empire method, divide and conquer, to a new version, unite and rule. Pretty soon, we're all going to be ready to plug in our electronic medical record in the collective Bohr cube, and we'll all be assimilated. And if you're not a Trekkie, I apologize. But there is a problem, because healthcare does not grow on trees. It is produced by somebody, and therefore is in limited quantity. People get outraged. Healthcare is a good? Yes, it is a good, very important good. And because it is a good and is limited, it has to be subjected to the economic law or the laws of demand and supply. And it has to be rationed. Rationing, per se, is not bad. It depends who's doing the rationing. Is it you according to the market, or is it the government by force? You ration yourself every day when you go shopping. You buy this, you don't buy that. Depends what you need. It depends on your budget, and it depends on the price. As the other speaker said before, what do you think is going to happen when the price is zero? Because healthcare is paid by the government. Well, the demand is going to start going up towards infinity. But don't you worry, because the government has learned from the past. It's already happened with Medicare and Medicaid, where the price skyrocketed, as you heard before, so that they had to go and dream the DRGs. in order to put some controls on the prices. This time, the proper rationing will be already in place. But who's better informed to ration? Yourself and your doctors, your patients, or the governmental agents? Years ago in Italy, my mother developed renal failure, and so she needed a dialysis machine. And hemodialysis was a covered benefits in Italy, except that she was put on an indefinite waiting list. I could not pay for her dialysis, even if I wanted to. The only hope she had was that somebody would die, and so a machine would get free for her. So I brought her to the United States. I started on hemodialysis, and unfortunately, a year later, she became so homesick that I had to say goodbye to her at LAX, knowing that it was going to be the last time I would see her alive. She went back, and since the machine was still not available, she was switched to peritoneal dialysis, much less efficient, which does not require a machine, and she was dead in 3 months. The Italian government was paying the bills, and my mother's life was not on the shopping list. When you switch over from the group who paid the taxes to the group who spends the money, you all of a sudden become very disposable. My mother died of an acute case of government rationing at the age of 63. More recently, my sister was diagnosed with an ovarian mass. Since the doctor was almost sure that it was not cancer, they gave her a date for surgery, which was necessary to be sure, for 6 months later. So she was smuggled by a nun into an office of a surgeon who was not supposed to see private patients because he's salaried by a government-run hospital. So she paid cash with no receipt for an illegal visit. And all of a sudden, a week later, she got her surgery. So I was enraged when I heard that. I mean, she was just fine. She said, well, you know, the system works. It takes care of the public, or otherwise we'll be dead in the street. We had one of the biggest fights about politics we had in our life, and we had many. I could not convince her that there's something wrong with the system, no matter what I said. Then all of a sudden it occurred to me. There is a fundamental difference in mentality between the American people and the people in socialized country. It has to do with the importance of the individual versus the importance of the group. And also it has to do with the role of government in the people's life.